Ceftriaxone. Class E's. Cephalosporins 3 degeneration. Pharmacology. Mechanism of action. Third-generation cephalosporin with broad-spectrum gram-negative activity. Has lower efficacy against gram-positive organisms, but higher efficacy against resistant organisms. Highly stable in presence of beta-lactamases penicillinase and cephalosporinase of gram-negative and gram-positive bacteria. Distribution. Distributed throughout body, including gallbladder, lungs, bone, bile, and CSF. Higher concentrations achieved when menings are inflamed. Crosses placenta. Enters amniotic fluid and breast milk. Metabolized in liver. Elimination. Half-life 5 to 9 hours. Normal hepatic and renal function. 12 to 16 hours. Mild to severe renal impairment. Dosage forms and strengths. Intra-abdominal infections. Complicated, mild to moderate. Community acquired 1 to 2 gram day for in single daily dose or divided Q12 hours for 4 to 7 days. In combination with metronidazole. Acute bacterial otitis media. 50 mg per kilogram IM once. Persistent or treatment failures. 50 mg per kilogram IV IM for 3 days. Pelvic inflammatory disease. 250 mg IM as single dose with doxycycline, with or without metronidazole for 14 days. Prosthetic joint infection. 2 gram for Q24 hours for 2 to 6 weeks. Continue treatment until clinical improvement observed and patient is afebrile for 48 to 72 hours. Meningitis. 2 gram for Q12 or for 7 to 14 days. Acute uncomplicated pyelonephritis. 1 to 2 gram for key day. Surgical prophylaxis. 1 gram IV 0.5 to 2 hours before procedure. Sexual assault. Indicated for prophylaxis of sexually transmitted diseases STDs, such as gonorrhea after sexual assault per CDC STD Treatment Guidelines 2021. Adolescent and adult females. Ceftriaxone 500 mg or 1,000 mg if weight greater than 150 kg IM once, plus doxycycline 100 mg BIDPO times 7 days, plus metronidazole 500 mg POBID times 7 days. Adolescent and adult males. Ceftriaxone 500 mg or 1,000 mg if weight greater than 150 kg IM once, plus doxycycline 100 mg BIDPO times 7 days. Septic toxic shock off-label. 2 gram for once daily with clindamycin for toxic shock. Acute epididymitis. Sexually transmitted chlamydia and gonorrhea. Ceftriaxone 250 mg IM 1 dose plus doxycycline 100 mg POBID for 10 days. Sexually transmitted chlamydia, gonorrhea, and enteric organisms. Men who practice insertive anal sex. Ceftriaxone 250 mg IM 1 dose plus levofloxacin 500 mg POKD for 10 days OR. Ofloxacin 300 mg PO-BID for 10 days. Enteric organisms. Levofloxacin 500 mg POKD for 10 days OR. Ofloxacin 300 mg PO-BID for 10 days. Skin and soft necrotizing infection due to Aeromonas hydrophilia. 1 to 2 gram for key day in combination with doxycycline due to Vibrio vulnificus. 1 gram for key day in combination with doxycycline. Continue treatment until further debridement not necessary. Clinical improvement observed, and patient is afebrile for 48 to 72 hours. Severe acute bacterial rhinosinusitis. Infection requiring hospitalization. 1 to 2 gram for Q12 24 hours for 5 to 7 days. Other gonococcal infections. Gonococcal conjunctivitis, 1 gram IM once. Disseminated gonococcal infection, 1 gram day IV IM. continued for at least 24 to 48 hours after improvement is observed. Then continued with ceftriaxone for 100 mg POQ12 or to complete at least 1 week of therapy. Gonococcal endocarditis, 1-2 gram for Q12 hours for 4 weeks. Gonococcal meningitis, 1-2 gram for Q12 hours for 10 to 14 days. Acute epididymitis, 250 mg IM once with doxycycline.